Hi, everyone. Welcome back to your favorite podcast. I'm your host, Belia Chavez, and today it's a great pleasure for me to introduce you to my guest. Today I have with us Yesenia Olmedo. Welcome, Yesenia.
Thank you for having me.
Yesenia, tell us a little bit about who you are, what it is you do. Give us a little bit of background. Who's Yesenia?
Sure. So, um, so I'm Yesenia Olmedo. I go by Yessie though. Usually Yesenia is when you're mad at me.
Oh,
But,
okay.
but,
Not mad at you.
but I am a psychiatric nurse practitioner, and I founded my own clinic called Buena Vida Integrative Health. I'm in South Overland Park by 151st and Metcalf. So we just opened like 3 or 4 months ago.
Nice.
So I am a medication prescriber. So I prescribe medication, I diagnose different conditions, but I like to treat the whole person holistically, kind of looking at, well, not just mentally, but what are your social connections? When was your last physical? What's going on with your day-to-day stress? How are we coping? So I like to treat holistically.
Holistically.
So
Perfect.
that is kind of my goal.
Perfect. So we can understand you a little better and get to know you a little better. Tell us a little bit about your background. Where do you come from? Like your family's originally from?
Yeah, so born and raised in California. Both of my parents are from Mexico. And I moved here when I was 14. So
14.
I would say I'm a Missourian here, Midwestern.
Okay.
Yeah, been here over half of my life, so this is home. I met my husband here, so
Your husband.
this is
Perfect.
home. Yeah.
Perfect. Wonderful. Well, thank you for being here. Well, Yesenia, tell us a little bit of the history of why you decided to go into this field.
Yeah. So I am trained as a family nurse practitioner. So I was primary care provider for several years, and I would take care of diabetes, high blood pressure, everything. And I think the biggest thing with that model is that you have a very small time frame and 5 to 10 different conditions. And it's like, how can you give good quality care within that small time frame? And unfortunately, you really can't. You can maybe talk about diabetes, but then you forget to mention all the different things. And I feel like I was missing lots of different things. Like, how do you tell a client, hey, we have to make these diet changes, do exercise? But how, I'm telling you to do it, but how do you do that? And it was very hard to kind of get good patient outcomes. So I actually worked on my doctorate project, and I focused on diabetes and kind of looking at different pieces, like where clients felt like they needed a little bit more help. Like, is it eating habits? And when you say low carbs, what does that look like? So it's kind of looking at those pieces. So with that, I found that I was missing a lot of anxiety, depression, eating disorders. So I decided to get to the root cause of the issue, focusing more on mental health, because if our mental health is better, everything else will start to fall into place. So I decided to kind of focus on the root cause.
That's important because we tend to go to the doctor and we think that we're going to get a magic pill and all our problems are going to go away. And what I end up finding out is sometimes the pill makes my problem worse because then now it adds a whole new set of problems. And a lot of times, like you say, you don't really have that one-on-one time to sit with your practitioner or your doctor or your primary care provider and really discuss what's the root cause. And it's easy for them to just refer you out and just get more medicine and more medicine and just kind of make the situation worse. So that's great that you know that there's more than just a magic pill, that there's a lot of things that need to be discovered internally in order to really find what's going on.
And I think you touched on something very important, that medications do potentially come with side effects, right? So every time you start a medication, you look at what are the benefits of this medication and does it outweigh the risk? And if the answer is yes, then you kind of proceed. But if you're like, there's still some things I haven't tried yet. Maybe it's therapy, or maybe, I've been so invested in work that I really need to work a little bit on my work-life balance. And those are things that, I can help you piece initially if you're kind of wondering what's going on, not really sure. I do 15 minutes free consultations just to touch base to see what would really be the best plan for you. I'm not feeling good, not really sure. Maybe you do, maybe you don't. What's really going on? And then we could kind of help kind of route you in the right direction.
So what type of different conditions do you treat or diagnose?
Yeah. So as far as major conditions I treat and diagnose, big two, anxiety, depression. With that, sometimes obsessive compulsive disorder kind of tags in, and ADHD is also something. That's kind of more on the radar right now, and it kind of mimics some of the anxiety, depression. So lots of the first visits kind of like, well, let's figure out which route. Is it a combination of both? Is it more anxiety? Is it more ADHD? And I think those are the biggest ones. And along with that, sometimes you identify some eating disorders. So those are kind of the big ones that I manage.
Or even drinking disorders, because something that I noticed, I'm not a psychologist obviously, but something that I came across a lot with people mentioning that when they drink alcohol, that tends to intensify their anxiety.
Yeah.
And it's kind of like they use the alcohol to kind of soothe their anxiety, but then it gets worse the next day.
Yeah. How does it, oh, sorry.
Go ahead. How does that work?
Yeah, so I can treat alcohol use disorder, and it's kind of good to mention, kind of the levels of care people might need. So if with me, I'm more outpatient. For the most part, clients are fairly stable, meaning that, they just need a little extra help, be it more guidance, be it medication. So if somebody just, I tend to drink a little bit more than I should and I tend to feel guilty, that's something I can help manage. But with that, there's different levels. Some people, it might be impacting their day-to-day. It might be impacting their relationships. They probably maybe can't hold a job. So depending on how much it's impacting your day-to-day, you might need a higher level of care. So I think that's also the thing, like, I have these symptoms. Is it mild, moderate, severe? I mean, that's very simplified version, but depending on the severity, you might need some inpatient care where you need that day-to-day support. Maybe have group settings where I'm not alone, there's other people like me that have the same thing and we're kind of working through it. So it might require different levels of care, so depending on how much is impacting your day-to-day.
That's good. So basically the first step would be if someone is suspicious that they may be suffering from one of the disorders, anxiety, OCD, one of the above mentioned, what would be the first step?
Yeah, I mean, I guess one of the first steps is reaching out for help, right? So depending on severity, if it's, I'm just not quite happy, I need a little bit extra guidance, help, kind of finding that right provider, because just because I'm here doesn't necessarily mean I might be the right provider. We all have different personalities, we mesh kind of differently, but it's finding that right provider that kind of resonates better with you. So kind of looking at what their profile looks like. So if you're looking for different providers, psychologytoday.com is probably a good go-to. If you're kind of sold that you like me, buenavidahealth.org. And then you can schedule a free telephone consultation and just talk to the provider, see, how they present things. Does this resonate for me? Does this sound like a game plan that I could work with? And it's finding that right provider. So.
Why is it important to get treatment early on though? Are these disorders conditions that can worsen if they're not treated from the early onset of them?
So I think everything is different. I can't really say it always manifests this way, because some people, anxiety, depression could kind of start low and intensify. Some people just comes in waves. So maybe you just need to find, when is it the high wave? Is it, certain season? Is it work related? So it depends how it presents. So everybody's a little bit different. But I think working with somebody will kind of help give you a little bit of more guidance. Like, is this something I have every year during the winter time? Or is this something when work, is more intense and then that's when I need more help? Or is it something, honestly, I've been suffering my whole life and I just really ignored it, but the more I have, more challenges, more, family obligations, more work responsibilities, and maybe it's intensifying. So everybody's story looks different. So it's really hard to say, well, this is what it looks like and this is the way it goes. It's a little tricky than that.
And I hear a lot of people also with the winter coming up, we're in July, but it's just a few months away. I hear a lot that people get depressed or they get angry or they're very unhappy around like the holidays. And I don't know if it's a myth, but they say it has to do a lot like with our weather, or there may be something that's triggering that emotion. What kind of recommendations would you have for someone who has that seasonal depression? I don't know what it's called clinically, so forgive me.
Seasonal affective disorder. Yeah, I mean, I think most people kind of get a little bit cooped up, because think in the wintertime you're out and about, you're socializing more, weather's more agreeable, you're doing more activities. Sometimes winter, it's colder weather, you're more inside the house, maybe more withdrawn. So sometimes it's kind of the way situations present. Other thing that I like to focus on from a medical standpoint is you get vitamin D from the sun, right? And when it's cloudy, you don't get lots of that vitamin D. So you might find that lots of people might have low vitamin Ds during that time frame. So that's also something important to look at from a medical standpoint. It's like maybe I need to check my vitamin D levels and see what they're up to.
So vitamin D can affect depression. I did not know.
Yeah. So that's why I'm like, well, when was the last time you had lab work? What does your thyroid look like? That's definitely things we could touch on a different one. But kind of looking at the whole picture, is it just this time? Is it a certain trigger? So yeah. So with that, some recommendations. Trying to maintain physical exercise to some extent, whatever that might look like. So you might not be going out walking, but maybe you could do more group exercise activities. Maybe you can consider on the days that are more nicer, like maybe 50 degrees, I'll put a couple jackets and actually go for a little walk. Because sometimes you do need to go outside the house in a very safe way, find different ways to socialize. But also, maybe you do have some seasonal affective disorder, and maybe that's something you can work with your provider. There's different medications, there's light therapy, so there's different strategies you could do, but I think one of the biggest things is just try to find a connection, because people tend to be more withdrawn because the weather's not agreeable, there's less activities, that type of thing.
And also different vitamin deficiencies can cause anxiety too, because I know I started noticing a connection with, I started having, I don't know if it's related to, they say it could be related to the menopause or whatever when you start transitioning, but I've also I started noticing that, and what started helping me was magnesium. I don't know if that, I started taking magnesium for another reason, but I noticed that it was helping my anxiety, and it kind of helped with those symptoms.
Yeah.
So yeah, sometimes you just have to check your, I don't know if there's a connection to it or not, but it definitely helped me with it.
I know magnesium has been used as a great supplement to help with anxiety, issues sleeping at nighttime, sometimes restless leg. And with all this, always talk to your medical professional and get a full evaluation so they can actually make these recommendations. This is just strictly for education purposes.
Right.
But I've had the connection of magnesium with sleep and anxiety. I'm not very well versed on that and like perimenopause, though I do know that when you're going through those changes, those hormonal shifts up and down could definitely affect with your mood. So that's something we could always look at from a different standpoint, kind of like maybe if there's any hormonal things, if there's more like supplements that could kind of help with some of those. So yeah. So I would agree with that.
And speaking about self-diagnosing, so nowadays it's very common that we like to Google and do checklists and self-diagnose, and we diagnose ourselves with so many disorders. But a lot of times, just because you have some of the symptoms, that does not necessarily mean you have, because there's a lot of people now, everybody has ADHD and anxiety because they go to TikTok and saw this checklist. But why is it important to really go see a doctor or a professional like yourself to get properly diagnosed?
Yeah. And I think you mentioned the first key, properly being diagnosed, because we all have traits. We all have little different tendencies. So I might have a little ADHD. My husband might have some OCD. But really, because we have these different traits, does that mean I have a disorder? And does that mean I need medication? Not necessarily. So I think that's kind of the big thing where I have lots of clients come in. I think I have ADHD. I think I have this. And I'm like, we have some traits, but I don't think it's impacting your day-to-day life where we need medication. Or you might have a couple tendencies, but you don't have a full spectrum. So I think that's the big key, is that we might have some traits, but that doesn't always necessarily correlate that you have XYZ disorder. So it's always, if you have any doubts or any concerns, it's always good to talk to a mental health professional, because they could probably guide you. It's like, well, we have these, but have you thought about anxiety and depression? Because da 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 da. So it's kind of looking at the whole picture, because sometimes when we just have this one questionnaire or this one thing, Okay, yes, 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 yes. But in the grand scheme, is there something in my past life that's
Mm-hmm.
causing me issues sleeping? That's the one thing I focus. Anxiety, depression, ADHD. If you're not sleeping good, you're not resting good. So you're going to be very
Disoriented,
distracted,
yeah.
disoriented the next day. So I'm like, before I even diagnose anything, I'm like, maybe we need to work on some of these lifestyle changes.
Right.
For any disorder we might be considering, I think good quality sleep is
Yeah,
very important.
definitely. And proper nutrition, because if I don't eat right, I get grumpy.
Exactly. So you got to feed yourself, you got to sleep good, you got to have a good work life balance. I think everything in life is just everything in moderation. Not too much of this, not too little of this, just a little. And I mean, of course, life happens,
Mm-hmm.
and some parts of the season might be more intense, but as long as you can acknowledge, like, oh, I've
Mm-hmm.
had like a rough couple weeks and I've noticed my moods affecting me, and I'm spending 60 hours at work. I'm like, okay, I need to balance something out. I need a self care day for me, whatever that might look for you,
Mm-hmm.
mani pedi, just stay at home and relax. Whatever that looks like, kind of identifying that I need a break and that's
Well,
okay.
that's very true. Let's talk a little bit about the cultural taboos. Some cultures are very open and receptive to therapy because they understand the value of it. But for example, our culture, Hispanics, we tend to kind of frown upon looking for help. Like it's kind of like, no, I'm not crazy. I don't need to go see anybody. I can handle this. It's like, I'm a man. I don't need no one to tell me what to do, or I'm a strong woman. We're always, kind of put in a position where if you go look for help, it's because you're weak and things like that. Or, they would say, oh, te hicieron brujeria, someone did voodoo on you or some witchcraft. That's why you're not acting right. So let's talk about, how can people overcome some of these obstacles, because sometimes we get so caught up in what are people going to think if I go seek help? You're not automatically going to medicate them, right? Obviously, you're going to look for ways to still, like you said, it could be so many factors that are affecting a person's behaviors, moods, things like that. So, what recommendations do you have for those people that are dealing with the internal struggle of should I go, should I not go, or what are people going to think about me?
Well, I think the first thing to acknowledge, and I think it's a World Health Organization, so like a major source, they 1 in 5 people, or 1 in 4. So that means that if you meet 5 people, one of those people is having some kind of anxiety, depression, some kind of mental, condition, and it's very common. And just because I have anxiety or depression does not mean I'm not a good provider or that I'm not a good mother. We all have that to some extent. And I think the first thing is acknowledging that it's more common than what you think. People don't kind of have things like, I have anxiety, I have depression. It's like we keep that a little private, but it's very common. I think part of the process is there's no shame in that. We all have it to some degrees, right? So I think that's the first thing. Second thing is, asking for help. And does that mean it's a therapist? Maybe. Does that mean it's confiding in somebody like, hey, Tia Belly, I'm having some issues. What's going on? Talking it out. Maybe you just need like stronger family support. Like everything looks a little differently. So it's kind of looking at where in my life am I missing something and where can I kind of make it a little stronger so that it's more balanced.
Perfect. And so, what about people who are noticing a relative or a friend is going through some changes? What are some red flags we should look for to try to get help for someone else, even if it's not for us at the moment?
Yeah. So I think it varies depending on what is going on or what combination of things are going on. But I think with depression, lots of the big things that you're noticing with that is that you have more sadness, activities you used to enjoy doing, you no longer want to partake in. So just kind of behaviors different from their normal. You might notice that they're not sleeping as good, or they're sleeping too much, they're eating too little, eating too much. So those are kind of some of the symptoms you're looking with depression: sadness, suicidal thoughts, anxiety. You got like maybe jitteriness, maybe just everything is like kind of excess, or maybe more irritable. So those are kind of the big two conditions that people more likely have and what they kind of look like. So always just being there for support, like, hey, I'm here for you. Anything you need, I'm here for whatever you need. If that's, just a hug, if that's just company, it looks different for everybody. So I can't tell you these are the correct things to do, but just having support, I think it's very important, because most people don't want advice, right? Just because I'm having something, I might not want to hear what worked for you. I might just want you to be there, give me some support, and yeah.
Right. Like you said, thoughts of suicide, most of the time, those are just thoughts. Many times they're not expressed. Like nobody really goes around saying, I'm thinking about ending my life, right? But it's something that happens so frequently. So, what are some of the behaviors or patterns? I mean, nobody's responsible, right, for the choices someone else makes. Everybody's responsible for their own actions, and sometimes there's no signs. But is there a pattern of where people can try to identify some of those signs, just to kind of maybe try to maybe be a little bit more involved in that person's life, making sure that person's maybe not spending so much time alone, kind of being there for comfort? What should we look for to make sure that it's not 100% guaranteed, but what can we look for to kind of try to be there for that person?
Yeah, I think that's a little hard because many people aren't vocal about it. Some people are very quiet about it. Some people, even if you ask them, they might not say anything. But if they are saying, hey, I'm having thoughts of suicidal ideation and I have this plan, you want everybody to be safe. So that's an ER type of emergency, right? But like, let's say if you're not really sure, but you're noticing that they're a little bit more withdrawn, more just having open communication, like, hey, I'm concerned. I've been noticing that you are not participating in activities like you used to. Would you like me to help you out? Would you, is there any obstacles, any challenges? Because you never really know what's really going on. So I think having that open communication, no judgment, I think is always a good place. Just that line of communication is always open if you need me.
Yeah, because I brought that up because thinking back historically, like we've heard a lot about of celebrities that have taken their own lives, and like even local people that appear to be happy. They're like the happy person, the one that's always joking around, yet they still took on that decision. So it's like really there's not one specific trait or symptom that you can look for. So that's kind of like a challenging, but at the same time, it causes a lot of guilt to those around them because they feel like they should have found the signs, they should have seen the symptoms. They feel guilty because they think they could have stopped it or prevented it.
Yeah. I think that is a very complex subject. And it's really hard to say because, with all the celebrities, we don't really know what was going on in their life. We don't know what their connections were. We don't know what their drug use was or what was going on in their day to day. We do know that different people have different coping mechanisms, and some people cope through humor. So maybe, you might feel super low, but this is the way I'm going to cope and this is the way it presents. So once again, I kind of say that, not judging anybody, but just, if you have a close family friend or something, just having good, like, hey, how are you doing? Anything I can help you with, any challenges you have. Because when you ask more specific questions and just have that line of communication, you're able to know better. But if you're like, hey, you look happy, see you next time. It's not very open, although I touched with you and had that connection. It's like I didn't really ask you very meaningful questions.
Right.
So I would still go with having that good line of communication and but also at the same thing is, I could only control so much. Because caring for myself, making sure I sleep, I eat, that's intense too. And trying to figure out my work-life balance is kind of figuring out, how much do I have control over what choices you decide to do? Unfortunately, I don't have much control. I could be there to give good support. If you need a hand, a hug, I'm here for you. But we all have challenges too.
True. That's true. Well, thank you so much. This has been great information. I know we can sit here and talk for hours and hours, but I really wanted to get this information out there to let everyone know that there's help out there. If you're looking for someone to talk to, if you're looking for therapy, if you're thinking, hey, I think I may have something that needs to be treated, sometimes just thinking about the idea of having something makes you even go more anxious and more into panic mode. So it may even intensify your feelings, and you may spiral just because you're thinking, I think I have this. So don't put yourself through that stress of self-diagnosing something that might not even be really a diagnosis. Like, go see a professional, go see an expert, find real help, holistic help, solutions, and don't self-medicate and use drugs and things like that. If someone is going through a crisis, where can they call?
Yeah. So acute crisis or any type of crisis, 24/7. Like the 911 line, there's a 988 line.
988.
So that's a suicide crisis. So if it's a Saturday, if it's 8 o'clock at night, 12 o'clock, that is your go-to line. So, and it's not necessarily that you're acutely suicidal, but maybe you're really sad. You know, maybe something's just not quite right. That would be your good go-to. And they're able to guide you more as far as, you know, go here, maybe reach out to this provider. They're able to guide you a little bit more on the next steps.
Yeah, and it's okay to be sad. It's okay to be mad. It's okay to be happy and have different emotions, because our bodies are designed to have different emotions. They're temporary though, and some take a little longer, but eventually we can overcome a lot of life's challenges, and most problems that we have on this earth are temporary. Everything has a solution. Some problems take a little bit longer than others, but hopefully the main thing is to know there's resources, that there's help out there, and you're not alone in this. And there's people like Yesenia who have clinics where they can help offer the support that you need. And so, Yesenia, what number can people call to schedule an appointment if they would like to book?
Yeah, so 913-344-4003.
913-344-4003. Perfect. And we're going to share the number here on the screen, and you'll be able to see her website as well. And you can reach out to her. And if she's not close to you, because you're licensed in Kansas, so you only serve Kansas patients. Well, if they live in Missouri, they can come to Kansas, but you can only serve them physically in Kansas. So whether you're in Kansas City or in Garden City, and Yesenia is bilingual too. So if you need someone to help you through the process in Spanish, she'd be more than happy to help you along the way. Thank you so much, Yesenia. Thank you all for tuning in.
Thank you.
Any last words of wisdom?
I think we touched on a lot of things, but if I could leave you with one thing, is care for yourself. Make sure you eat, you sleep, you rest, and you enjoy life. Everything in moderation.
Everything in moderation. Excellent. Thank you all for tuning in. I hope this podcast was helpful, and that you reach out to Yesenia or a local professional if you need any assistance. Thank you very much. See you guys next time.
Bye.
Bye-bye.